Hi, this is Mackenzie. So for my clinical experience, I was at the Medical Center of Aurora, and I had a really good experience. I felt like I learned a lot. So some things I identified as strengths were that I effectively communicated with both the nurses as well as the patients. So I made a point of when I showed up for the day, when I learned what nurse I was assigned to, I'd ask them if there's anything I could do to make their life easier and their day flow more smoothly. So I helped answer call lights, and then whenever we went into a room to do an assessment, I just automatically grab the vitals cart and start taking vitals. And then for family members and patients, I'd always introduce myself as a student nurse, but kind of reach out to them and let them know that I too could help them if they need anything. And I think just taking that moment to make a connection really helped, because then people would ask me hey, can you grab me some ice? Can you grab me some water? And kind of it made it easier for my nurse, and then it also helped me work on establishing better patient-student care. And then I also advocated for new experiences. So I saw an anesthesiologist going into a room to do an epidural, and I was like, hey, can I come watch? And we made sure it was okay with the patient, but it was an awesome experience. I got to see an epidural placement. I also got to see a vaginal birth as well as a C-section. I did an IV placement, and then also got to do a baby's first bath. And then another strength would just be asking a lot of questions. So I didn't feel very comfortable with fetal, looking at the strips in class. And so just kind of seeing it in real life and asking nurses, what are you looking for? And just getting additional feedback and having more exposure really helped with my confidence. And then when I was in the NICU, I was actually working with a nurse who also was a lactation consultant. So just getting to pick her brain on her job was really helpful. Areas of weakness include gaining more confidence when working with patients and providing patient care. I think as new nurses, we're always kind of erring on the side of cautious, almost being timid, whereas as a nurse, it's important to be cautious, but also kind of confident with what you are doing. And a good example of this would be when I was giving a newborn their first bath. I was very carefully rubbing their head and kind of combing their hair out. But the nurse I was working with said, you can scrub their head a little bit harder, it's not going to hurt them. And so I think that's an important thing, is to still be cautious, but also be efficient in what you are doing. And so in order to improve moving forward, I think, first of all, it's important to ask for feedback. If I had not asked that nurse what I could have done better, I wouldn't have learned that I could have scrubbed the head a little bit harder. And so I think always looking for areas of improvement is important. And then additionally, I think just watching a nurse first, if you haven't done a task before, and kind of asking questions is helpful, because then when you go in to do it, then you have more confidence. Another area of weakness would just be technical skills in general. So I had the opportunity to place an IV, and it actually turned out to be another great learning experience. So I was trying to do a hand IV, and I didn't anchor it very well, and so I had just gotten adjacent to the vein, so I kind of got in, but not quite, and ended up having to restart. But afterwards, when I was debriefing with my clinical scholar, she made a really helpful point that I'm going to use moving forward, and that is when you anchor, to kind of see where the vein bifurcates, and then go more distal to that, because then it's easier to get into the vein. And so I think, again, just having conversations about, hey, what can I do better? How would you improve? Is extremely beneficial. And then for future applications and learning, I think just continue asking questions. I learned a lot from just talking to the nurses. They have so much insight. A lot of the people I worked with had been working at the hospital for 20, 30 years. And so they knew a lot. They definitely knew their stuff. And so it was fun asking them questions. And then just advocating for new experiences. I think that the more hands-on you get and the more you see and the more you do, it betters you as a nurse and then increases your skill level. And then I think, again, just letting patients know that even though I'm a student, I'm available, I'm here for you, please let me know what I can do. Because just giving them, letting them know that you're not there just to watch really helps them reach out and ask you to help them with things too. Thanks.